So today we're going to continue to go through our ICD10 guidelines with examples. And if you remember, we are on Chapter 3 in our chapter-specific ICD10 guidelines. And this is in front of each individual chapter in your ICD10 book. So we have our guidelines in the front of our ICD10 book, and then we also have our guidelines in front of each specific chapter. So we finished Chapter 2 last Webex, and now we're on to Chapter 3. Chapter 3, as you can see from the screen, has no specific guidelines with examples for us. So the reason this is this section is actually reserved for future expansion. So you can see that from this right here. So we're going to just continue on to Chapter 4. Chapter 4 is our endocrine, nutritional, and metabolic diseases, E00 through E89. And actually, before we get to that, I just want to touch base on the different flags at the bottom of each of these pages in our guidelines. So as you can see from the screen that I have up now, we have a checkbox with additional character required. We have a checkbox with a 7th placeholder alert. That's letting us know that there are 7 digits in our code, or 7 characters, and so we might have a placeholder of X in the code. So anytime you see that to the left of a code in the tabular, you know that there's going to be a 7th characters. Unacceptable primary diagnosis, that's what PDX stands for. So you see that in the gray shading. That means that that code can never be coded first. Our next little flag at the bottom is manifestation. So the manifestation is in the blue color, and that means that that is a manifestation of another disease. So it's just alerting us of that. So you will see these by the actual codes in our book. So we'll know, okay, hey, this can never be a primary diagnosis, or this is a manifestation code. Our next flag is the hospital-acquired condition. This is really big right now for inpatient coding. You'll hear them referred to as HACs. So a HAC is a hospital-acquired condition, and our ICD-10 book will flag us with a yellow color around the code, and that lets us know that this is a HAC, or a hospital-acquired condition. Why something like this would be important for reporting purposes is if a patient acquired a condition in the hospital, what if it is, an example would be a line infection. So they had, some sort of PICC line for antibiotics or for some sort of treatment, and they acquired a infection because of that. So the hospital-acquired infection wouldn't necessarily be the payer or the insurance company's financial responsibility. So it's really important that we monitor that. And it's also important for tracking purposes. So Medicare or Access, they want to know if hospitals have, how many hospital-acquired conditions do they have, how many are being reported, so they can track that, and that's for a quality of care issue. So anyway, there's just some background on hospital-acquired conditions. We'll actually get into that in the future, and just have maybe a quick tip sheet in our tools for current students on hospital-acquired conditions, because if you get into the inpatient side of coding, it becomes very important. We also have excludes 1, not coded here. So if you remember from our guidelines, excludes 1 means never coded together, right? There is an exception, and that was released in our ICD-10 2017 guidelines, but for the most part, an excludes 1 note means these 2 codes cannot be coded together. And then I just suggest that we all go into our ICD-10 2017 guidelines, which are also on the current students portal, and that way you can actually see the change in the change in the description of the excludes one guideline. So basically, excludes one, you still need to think of it like these two conditions cannot be coded together. And the updated version of the 2017 guidelines is they can't be coded together unless they coexist separately. And there's more in-depth instruction around that. So take some time, either today or in the next week, to really pull up the 2017 ICD-10 guidelines off of the current students portal, and then you can compare the two. Excludes two, that means not included here. So an excludes two note would just signify that, hey, you can code this code too if it exists, right? So basically these little tabs at the bottom of our book page here, they're just letting us know if we see these highlights or this little box next to the code, we know that either an additional character is required, or this is an unacceptable primary diagnosis, or etc. Okay, so let's go ahead and get into our Chapter 4, chapter-specific guidelines. So we can see we're going to start with diabetes mellitus. This is a big, common diagnosis. No matter what type of coding that you're doing, diabetes has increased, and it's definitely a serious condition. If you think about diabetes as the gateway drug almost, so the diabetes is like a gateway diagnosis. Once you are diagnosed with diabetes type 2, there's all sorts of complications and manifestations that can arise from that condition if it's not treated or cared for appropriately. So, and even if it is. So diabetes, the diabetes codes are combination codes that include the type of diabetes, and we know our types of diabetes are type 1, type 2, juvenile, right? They also include the body system affected, so it could be our diabetes with renal, diabetes with eye complications, diabetes with circulatory complications. That's the body system, and the complications affecting that body system. This is an important little sentence right here, so make sure you highlight it. As many codes within a particular category as are necessary to describe all of the complications of the disease may be used. So it doesn't matter how many diabetes you have, how many diabetes with complications, so diabetes with renal, diabetes with neuropathy, diabetes with retinopathy. If they all exist, they can all be used to fully capture all of the conditions of that patient, right? They should be sequenced based on the reason for the particular encounter. Assign as many codes from categories E08 through E13 as needed to identify all of the associated conditions the patient has. So the only caveat to this is if a patient has type 2 diabetes unspecified and they have a type 2 diabetes with complications, you wouldn't code the unspecified code 2. You could code all the complications the patient has together. But once you have diabetes with unspecified and diabetes with a complication, it's not making sense because the diabetes that is unspecified is no longer unspecified. It actually is diabetes with complications. So let's check out our first example. Patient is seen for uncontrolled diabetes type 2 with diabetic polyneuropathy and diabetic retinopathy with macular edema. So we see that we have our codes E1165, E11.65, E11.311, and E11.42. So you can see from the code descriptions that type 2 diabetes with hyperglycemia, so that is signifying the uncontrolled diabetes. That was a big change from ICD-9 to ICD-10. Uncontrolled diabetes is no longer coded without hyperglycemia. So uncontrolled diabetes is type 2 diabetes with hyperglycemia. Type 2 diabetes mellitus with unspecified diabetic retinopathy and macular edema. So this is from the diabetic retinopathy and macular edema. So there are different types of diabetic retinopathy. If it was more specifically documented, we would have coded it a little bit differently. But for unspecified retinopathy, diabetic retinopathy, here's our code. And whether you have macular edema or not does change the code description. So make sure if it's in the documentation that either if it says with macular edema, but if it doesn't say anything, or if it says no macular edema, it would change the code description. Then we have E11.42, and that's our type 2 diabetes with diabetic polyneuropathy. So as you can see, we used as many codes as were necessary to fully describe the diabetic complications as needed. Many combination codes describe more than one condition, and we would code first the reason for the encounter, and uncontrolled is described as with hyperglycemia, and that was our rationale. So the type of diabetes. The age of a patient is not the sole determining factor, though most type 1 diabetics develop the condition before reaching puberty. For this reason, type 1 diabetes mellitus is also referred to as juvenile diabetes. So that's an important little tidbit to know. A 45-year-old patient is diagnosed with type 1 diabetes. So here's our code, E10.9, type 1 diabetes without complications. Explanation. Although most type 1 diabetics are diagnosed in childhood or adolescence, it can also begin in adults. So type 1 diabetes is your pancreas does not produce enough insulin, and so you will be insulin dependent if you're a type 1 diabetic. And with that being said, you wouldn't code the additional code, which we'll learn about in just a few minutes. There's an additional code for long-term use of insulin. You wouldn't code that with type 1 diabetes because it's inherent to that condition. You know that you have to have insulin to treat your type 1 diabetes. But that isn't the same for type 2 diabetes, which can be controlled by diet and other medications and insulin. So if the type of diabetes mellitus is not documented, so say we have the office visit documents diabetes and hypertension on the patient problem list, right? Type 2 diabetes without complications is E11.9, and I10, essential primary hypertension. And the reason is because the type of diabetes was not documented and no complications are noted, we always default to type 2 unspecified diabetes, which is E11.9. So if the type of diabetes is not documented in the medical record, the default is E11 type 2 diabetes. Here we're going to get into our diabetes and the use of insulin. So if the documentation in the medical record does not indicate the type of diabetes, but does indicate that the patient uses insulin, code E11 type 2 diabetes mellitus should be coded, and code Z79.4 long-term current use of insulin. This code indicates that the patient uses insulin, right? So code Z79.4 should not be assigned if insulin is given temporarily to bring a type 2 patient's blood sugar under control during an encounter. So if a patient has out of control diabetes, they're given insulin just to bring that out of control diabetes in control, we don't code long-term insulin. Office visit lists chronic diabetes with daily insulin use on a patient problem list. Our codes are E11.9, type 2 diabetes without complications, and Z79.4, long-term current use of insulin. And our explanation is, do not assume that a patient on insulin must have type 1 diabetes. The default for diabetes without further specification defaults to type 2, and we add the code for long-term use of insulin. For the diabetes in pregnancy and gestational diabetes, we are going to refer you to section IC.15, diabetes mellitus in pregnancy and gestational pregnancy-induced diabetes. So remember, we learned this before, all of our pregnancy codes, even if it's a complication like diabetes that is in another chapter, all of our pregnancy complications are in the DO chapter, or they're all in the same place. So we're going to move on to complications due to insulin pump malfunction. And our first example here, underdose of insulin due to insulin pump failure. So an underdose of insulin due to the actual pump failure is going to be assigned to a code from T85.6, which is a mechanical complication code. So it's actually mechanical complication of other specified internal and external prosthetic devices, implants, and grafts that specifies the type of pump malfunction as the principal or first listed code, followed by code T38.3X6-, and that's where we would actually see the 7th character flag, underdosing of insulin and oral hyperglycemic anti-diabetic drugs. Additional codes for the type of diabetes and any associated complications due to the underdosing should also be assigned. So we have a 24-year-old type 1 diabetic male treated in the ED, the emergency department, for hyperglycemia, insulin pump found to be malfunctioning and underdosing. So our code breakdown is T85.614A, breakdown of insulin pump, initial encounter. Yes, there can be more than one encounter. T38.3X6A, underdosing of insulin and oral hyperglycemic anti-diabetic drugs, initial encounter. And E10.65, type 1 diabetes mellitus with hyperglycemia. Explanation. The complication code for the mechanical breakdown of the pump is sequenced first, followed by the underdosing code and type of diabetes with complication. Code all other diabetic complication codes necessary to describe the patient's condition. And our next example under this guideline is overdose of insulin due to insulin pump failure. So the principal or first listed code for an encounter due to an insulin pump malfunction resulting in the overdosing of insulin should also be T85.6- mechanical complication of other specified internal and external prosthetic devices, implants, and grafts, followed by the code T38.3X1- poisoning by insulin and oral hyperglycemic anti-diabetic drugs, accidental. So it's an unintentional poisoning, because an intentional poisoning would be an overdose. Two, both of them are overdoses, but whether it's accidental or intentional changes your code. So our case study here is a 24-year-old type 1 diabetic male found down with diabetic coma, brought to the ED and treated for hyperglycemia, insulin pump found to be malfunctioning and overdosing. We have our T85.614A. That's our breakdown of the insulin pump, the initial encounter, exactly the same as our previous case study for underdosing. T38.3X1A, poisoning by insulin or oral hyperglycemic anti-diabetic drugs, accidental, unintentional, initial encounter. And E10.641, type 1 diabetes mellitus with hyperglycemia with coma. So do you see how from our previous example to this example, the documentation being different changes the diabetic code? So in our first example, we had diabetes with hyperglycemia or uncontrolled diabetes. In this example, we have diabetes with hyperglycemia and a coma. So there's an additional code for that. So you really have to pay attention to the documentation with these diabetic codes, because depending on the complications they have, it could be included in the code specifically, and it will change the code description. So our explanation or our rationale, the complication code for the mechanical breakdown of the pump is sequenced first, followed by the poisoning code and the type of diabetes with complication. All the characters in the combination code must be used to form a valid code and to fully describe the type of diabetes, the hypoglycemia, and the coma, which we just went over. Our next guideline is going to cover secondary diabetes mellitus. So codes under categories E08, diabetes mellitus due to underlying condition, E09, drug or chemical-induced diabetes mellitus, and E13, other specified diabetes mellitus, identify complications, manifestations associated with secondary diabetes mellitus. Secondary diabetes is always caused by another condition or event. So some examples would be cystic fibrosis, can cause secondary diabetes. A malignant neoplasm of the pancreas can cause secondary diabetes, and you can imagine why. If you get cancer of the pancreas, which produces insulin, and it affects the pancreas's inability to produce that insulin, then you could have secondary diabetes as a result. A pancreectomy, so you have your pancreas removed, or an adverse effect of a drug or poisoning. So secondary diabetes, the really simple way to look at it is if your diabetes is a result of another condition, it's a secondary diabetes. If your diabetes is a manifestation of another condition, it's secondary diabetes. If a condition is a manifestation of diabetes, then diabetes is it's not secondary, it's primary diabetes. And the conditions that have resulted because of the diabetes, those are secondary diagnosis. Those are the manifestations. So if your diabetes is caused by some other condition, it's secondary. If another condition is caused by your diabetes, it's primary. Secondary diabetes and the use of insulin. So for patients who routinely use insulin, code Z79.4, long-term current use of insulin should be coded. Code Z79.4 should not be assigned if insulin is given to temporarily bring a patient's blood sugar under control during an encounter. Same guideline as primary, right? Type 2 diabetic with no complications, normally only on oral metformin, is given insulin for 3 days to maintain glucose control while in the hospital recovering from surgery. So this is a type 2 diabetic who's normally on a pill for regulating their insulin, and they aren't on insulin itself. The code is E11.9, type 2 diabetes mellitus without complication. And we don't use a code for the insulin. First, because they're not on long-term insulin use, right? Do not code the long-term insulin when only provided temporarily. And our next example is type 2 diabetic with diabetic polyneuropathy on insulin. So in this example, we have E11.42, type 2 diabetes with diabetic polyneuropathy, and Z79.4, long-term current use of insulin. And our explanation is that we're going to add that Z code for long-term use of insulin because the insulin is taken chronically. So it's long-term insulin use. Our next guideline is assigning and sequencing secondary diabetes codes and its causes. The sequencing of secondary diabetes codes in relation to codes for the cause of diabetes is based on the tabular list instructions for categories E08, E09, and E13. And remember, those are secondary diabetes categories. Secondary diabetes mellitus due to pancreectomy. For post-pancreectomy diabetes mellitus, lack of insulin due to the surgical removal of all or part of the pancreas, assign code E89.1, post-procedural hypoinsulinemia, assign a code from category E13 and code from subcategory Z90.41, acquired absence of pancreas as additional codes. So, patient with newly diagnosed diabetes after surgical removal of part of pancreas. Our examples here are E89.1, post-procedural hypoinsulinemia, E13.9, other specified diabetes mellitus without complications, and Z90.41, acquired partial absence of the pancreas. And our explanation here is to sequence the post-procedural complication of the hypoinsulinemia due to partial removal of the pancreas is the first listed code, followed by the other specified diabetes NEC, with or without complications, and the partial or total acquired absence of the pancreas. And our last secondary diabetes guidelines, secondary diabetes due to drugs. Secondary diabetes may be caused by an Secondary diabetes may be caused by an adverse effect of correctly administered medications, poisoning, or sequela of poisoning. And it's going to refer us out to a different section guidelines for coding adverse effects and poisoning and external cause reporting as well. Initial encounter for corticosteroid-induced diabetes mellitus. So we have secondary diabetes due to taking a steroid, right? E09.9, drug or chemical-induced diabetes mellitus without complications. And T38.0 X5A, adverse effect of glucocorticoids and synthetic analogs, initial encounter. And our explanation is, if the diabetes is caused by an adverse effect of the drug, the diabetic condition is coded first. If it occurs from a poisoning or overdose, the poisoning code causing the diabetes is sequenced first. So that's an important note to keep in mind. And we're not going to start our Chapter 5 chapter-specific guidelines. We just finished Chapter 4. But I do want to say that we've added some new sections to our current students portal. We've added Q&A, and we've also added exam tips. So a section on exam tips, so different documents that can provide some assistance on what you can bring to the exam and just some test taking tips. And then our Q&A section is under construction, but it's currently being worked. And that's going to include any questions submitted by our students, and we'll just title them by topic so you can easily reference the answers there because a lot of students are asking the same type of questions. So it's just a good place to have it documented so you can always reference it. So as you submit questions for us, we'll respond to them, but we will also make sure that we upload them on the current students portal for you to reference there. Okay, and see you next week.